Your host, Doris Bauer.
Well, good evening, Philippine Nurse listeners and followers. Magandang gabi po sa inyong lahat. Our program, Philippine Nurse, as you know, is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. So thank you very much for joining us again today. Well, we are definitely in the dog days of summer. It is hot, hot, hot. And we are pretty much in the triple-digit temperatures. So it is easy to get burned from this heat, don't you agree? And so today we are here to talk about how to handle and treat burns that happen during the summer heat. So please welcome our guests from the University Medical Center of Southern Nevada, known as UMC, the Nevada Burn Care Unit, Mr. Ryan Moore and Ms. Jasmine Conaway. Welcome to the program.
Thank you very much.
Thank you for coming here. And Mr. Ryan Moore is I'm going to have you guys tell something about yourselves. Mr. Ryan Moore is the clinical manager of the Burn Care Unit at UMC, right, Ryan?
That is correct.
So can you tell us a little bit about yourself?
Sure. So I've been working in critical care nursing for about 17 years, but I'm new here to Nevada and to Las Vegas. So I've been with UMC for the past year now as the clinical manager of the Burn Care Unit. So,
very good, very
yes.
good. Yeah, I used to work there ages ago. And Yasmin, this is not your first time in this podcast. You were here a couple of years ago. And Yasmin is the burn program manager of the Burn Care Unit, right?
That's correct. Yes,
So-
thank you for having me back.
Of course. So tell us a little bit about yourself.
So I have been a nurse for about 17 years. About 15 of that has been in burn care, so burn care is definitely my passion. As far as the program manager, I've been in this role for about 3 years now.
Yes. Very good. And our hats off to the Burn Care Unit. You guys do good things. Okay, so can you give us a little brief history of the UMC Lions Burn Center? Why is it called the Lions Burn Center? Who wants to take that one on?
I can go ahead and take that
Yes.
one. So we've been around for about 53 years. Prior to that, there was a young girl that was playing with fire. She saw a magic trick on her television, and in replicating the magic trick, she caught her clothing on fire.
Oh, wow.
And at that time, UMC was the closest hospital. Her family brought her there, but there was no burn center at the time. The closest one was in Texas. She wasn't stable enough to be transferred. She later on died from her burn injuries. So her father was actually a Lions member, and at that point, he said, there is a need in this community. We need to build a burn center so that this doesn't happen to anybody else. So working with UMC and the Lions, they built a burn center 53 years ago, and that's why we carried the Lions name.
You do, and you still have a good collaboration and working relationship with that organization, correct?
Absolutely. They are so generous with donations and helping us plan different events with our survivors. It is a really great collaboration with them.
That's very good. And they're not planning on renaming the the Burn Care Center, no. It's still called the UMC Lions Burn Care Center, correct?
That is correct, yes.
Okay, all right. So good relationship with them. Okay, so what are the services that UMC Burn Care Center, what do you guys provide?
So we cover basically from initial injury all the way through aftercare. We know that burn injuries is lifelong, and so as soon as they come into the hospital, they are seen by numerous team members. So our physicians, nurses, therapists, lots of different people. And then even once they've left the hospital, they follow up in our outpatient clinic. So we have physicians, nurses, nurse practitioners, a team still following them. And even afterwards, we provide support groups and different activities, because we know that it is lifelong and that they do continue needing resources afterwards.
Right, right. So Ryan, you just joined the team as their manager. What do you think of the team? They're pretty awesome, aren't they?
Oh, it's great. This is a wonderful team to work with. Everyone collaborates so well as a team, and as Yasmin said, it does take many different disciplines combining for the total care of these patients, and just truly collaborative team environment. So it's a great team to work with. I've really been enjoying everyone that I work with, so I'm very proud to be a part of this organization.
Very good, very good. And you do have that full-blown inpatient as well as outpatient program, and of course you collaborate with a lot of people in the community, correct?
Yes, we do. Not only do we partner with the Lions, but we also partner with Firefighters of Southern Nevada, Burn Foundation, and other community partners. There's a lot of great collaboration to provide support for our patients.
Yes, that's good. We had the firefighters here a couple of years ago, so during the firefighting prevention season, so maybe we can have them back.
I'm sure they would love that.
Yes, okay. So the UMC Burn Care Center is pretty much very involved in protecting the community, as we had heard. I know that you want to talk about burns in our community, and of course we had a conversation earlier, said we live in the desert and we do experience extreme temperatures where we can see burns from contact with, for instance, the pavements. Would you like to talk about that, Yasmin?
Yeah, absolutely. During the summer months, usually between May and September, that's usually our hottest months, when temperatures get to about 110, 120, the surface, so like asphalt, concrete, lava rock, all of those surfaces can get up to 170 degrees.
Wow.
And so really only takes seconds to sustain a deep enough burn that does require hospitalization. So a lot of what we do in the summertime is bringing awareness to how to prevent these injuries. We've started a flip-flop campaign several years back where we're collecting flip-flops and handing them out to high-risk populations such as the homeless. We've also identified that there are certain populations that are more at risk for developing these burns on their feet, such as diabetics, because they have neuropathies, they're not feeling their feet. Maybe they want to go to the mailbox and don't realize how hot it is, and when they get back, they have second and third degree burns to the bottom of their feet. We've also identified that our elderly and our pediatric populations are at higher risk also because they have thinner skin, so it takes less time for them to sustain a deeper burn.
Right.
We've also identified those with limited mobility, so anything causing somebody to fall on the pavement, syncopal episodes, seizure disorders, things like that, that they fall on the ground and they lay there for an extended period of time. They're also at higher risk for sustaining these pavement burns. So bringing awareness to those populations that if you are going to be out, bring somebody with you. Go to the grocery store with a friend so that if you have trouble getting back into your car, somebody can help you. Little things like that can help prevent.
Yeah, that's good. So do you have classes for these types of to-dos with the community, or?
We do. Through our Healthy Living Institute, we have a First Aid for Burn class where we talk about some of these high-risk populations and what to do if you do sustain a burn, some basic first aid, and when to look for medical attention.
Medical attention. Okay. Oh, and let's not forget our pets too, right?
Absolutely. I've got a couple of dogs, and they are just as vulnerable in this heat, and so definitely we want to make sure that if you are taking them out for a walk, that you're going early in the morning or late in the evening when it is this hot, because it is too hot for them on the pavement. And, even though they have those little booties and everything for dogs, you can sustain burns through clothing and things like that. So when it's really hot, we still need to be careful. And so, it's best if we can to be, out with our animals early in the morning, and then during the hot temperatures of the day, keeping them inside as much as possible.
Right, that's great. And I like that you mentioned the elderly and the homeless. So I'm really glad that you have, you're taking care of these people, getting awareness to this high-risk population. So thank you for that. So, Ryan, by the way, you had talked about a social media challenge trend that you have seen in the past year that, well, it, I guess, affects our younger population, which is a challenge, I guess, from TikTok on burns. Can you explain?
Yeah, so, just like, Yasmin had mentioned how we got affiliated with the name The Lions, with a young girl who was trying to copy something that she saw on TV. The new generation, it's social media and things that they're seeing on TikTok and other areas of social media where some of these challenges are using fire and using hairspray on mirrors and lighting it on fire. Or we've heard of some other ones of people using rubbing alcohol and maybe putting it in their hand and lighting it, thinking that the alcohol will burn off and they won't sustain a burn. But over the past year, we have seen an increase in young patients ages 11 to 15 or so that have sustained pretty significant injuries. And in some cases, it's also led to homes being burned down.
Wow.
So this is very serious, and it's not just us in our community that we're seeing this. This trend has been nationwide. We've seen many injuries throughout the country that this is a growing trend, and it's very dangerous. It's,
I'm really very concerned about that. I heard about this one victim that I guess he's still in the hospital, I believe. And then it's disturbing to me that it's a growing trend here in our community.
Yeah, I think young people, teens and preteens, are under a lot of pressure to fit in, and sometimes they, try some of these things as a way of fitting in, or, whatever the reason. We are seeing this growing trend and of people, getting severely injured, and and that's a very difficult age to. Anyone that sustains a burn, it's very difficult and life-altering, but, definitely at that age, it's very challenging for them to deal with this.
Right.
But, like I said, we've seen some really significant injuries, and, hope that we can, reach parents to make them aware of some of these dangers and, talk with their children and hopefully prevent some of these injuries from happening and people trying some of these challenges, because they are very dangerous.
They are very dangerous. Do you have anything to add to that?
I just wanted to add that we do provide a class which we work in conjunction with local fire departments for these kids that have been misusing fire. So we identify these kids, whether it's a social media challenge or not, and we look at the consequences of playing quote-unquote with fire, where we look at the legal ramifications along with the medical consequences, because a lot of kids and parents don't realize how dangerous this really can be.
They are. And especially with, the kids that are probably not even monitored by the parents in using social media, right? That's a big challenge.
Absolutely. It's, I think the parents need to be aware of what their children are viewing on social media, and I think that TikTok, presents some challenges in that it's kind of designed so that you don't always know what your kids are watching, and so I think that parents really need to be aware of some of the things that are out there and what children are trying these days.
Well, I'm really, I don't have young kids anymore, but this is really a growing concern. Whatever happened to the ice bucket challenge that we did years ago? Just pour ice bucket over yourself. I guess they have become more, what do you call this, creative, and challenging people in social media has become really a big trend. So, and it's just mind-boggling to me. But so aside from pavement burns, what other ways do you think burns can be sustained, especially in this heat of summer?
So certainly we see, sunburns. We've had some patients recently with really bad sunburns. So, anytime that you're out in this weather, really you should be limiting your time out there in this. But if you do have to be outside, wearing hats, wearing protective clothing, sunscreen, all of that. So we do see a lot of significant injuries just from sunburns. But, we can see all variations of burns. We see electrical burns, we see flame burns, scald burns. So there's a lot of different things that we treat. So any kind of burn that is sustained, we're able to treat that at our facility. But definitely this time of year, we see an increase in the pavement burns and sunburns and things like that.
That's great. It's not great, but you do have a flyer here that you disseminate to the media. What are the, and we can show them on screen as well, what are the do's and don'ts of treating burns at home? You want to take that on?
Yeah, there's a lot of myths out there that I've noticed. Patients will come in with random things on their burns. So staying away from ice, that actually makes the burn worse. So to cool the burn, just run it under cool running tap water. That's sufficient enough to cool the burn.
Not ice.
Not ice, that's correct. And then don't put any kitchen products, anything in your pantry. We've seen eggs and butter and mayo and toothpaste and all these different things. So avoiding those type of things. Really all you need is a clean bandage on there, and then come see us in the burn clinic, come see us in the hospital. We can provide some guidance as far as what to put on there and how to clean those off.
Okay. All right. What's your opinion on that too?
So I, certainly, like she said, it's the safest thing is just you want to try and prevent that burn from getting any deeper, so you immediately want to run it under cool water. Avoid cold water or ice, like she said, is that actually decreases blood flow to the area. And just if it is a burn that is in certain areas, such as on your hands, on your face, genitals, ears, those sensitive areas near your eyes, that's something that you really need to immediately seek attention from a burn center. Or if the burn is larger than the size of the palm of your hand, that is a burn that you definitely want to get checked out. Burns that go all the way around your arm, so if it's circumferential, that's a burn that absolutely needs to be seen in a burn center.
In a burn center.
Right.
So, okay, that's great. So what do you do if you have blisters? If you get a blister from a burn?
It depends on the size of the blister. If it's something small and it's not impeding your function, so if it's not in an area where you're like on a joint or anything like that, it's your body's Band-Aid, so leaving it intact is probably the best. If it's large enough that it does need to be opened up, then seeking medical attention at that time, because making sure that when those blisters are opened up, it's done in a clean fashion, not introducing any kind of bacteria.
Okay.
So then that's when we would encourage somebody to come see us.
Okay, so you have to take a look at where the location of the burn is. You have to take that into consideration, especially for the blisters as well. Don't get. Well, I'm looking at your flyer here. So you say, when do you seek medical attention? That is.
So anytime, again, that is larger than the palm of your hand, burn, or that goes all the way around an extremity, or just anything that after a couple of days, if the pain's not getting any better or the redness is getting worse, or if it's large enough that you're not having a lot of sensation there, that may be a deeper burn that needs attention as well. So there's a lot of reasons that it is recommended that you come in and get that checked out at a burn center. And, one of the things that we like to tell people is just, this is not something that can be treated just anywhere, is that, not every hospital is equipped to deal with these sorts of injuries. And so it is best to go to a burn center. So, we really want to encourage people to come to a burn center.
And then if I can just add to that, specifically about our burn center that I really like to share with everybody is that we are the only verified burn center in the state of Nevada.
Right.
And what that means is that we are held to a certain standard from the American Burn Association, that we provide the highest level of care in burn care. So we know that the care that we're providing is the most up-to-date, most evidence-based, and that we're following the standards that are put forth by this accrediting body, the American Burn Association. They look at a lot of things, including our quality metrics and things like that, to ensure that we are providing the best care. And if there are opportunities for improvement, that we are always looking at that and providing additional support so that we can always get better. Because we do want to do what's best for our patients. So, and then they also look at our multidisciplinary team. Burn patients require a whole team that I mentioned earlier. So if you think about, what I like to explain is, if I fall and I scrape my knee or I have a burn on my hand, that's nothing that requires hospitalization. But even then, it's so painful that I don't want to move it. I don't want to do anything with it. And so our team knows how to work with these patients so that we can move those extremities so that we don't lose functionality. And then the psychosocial aspect as well. We have family therapists, child life specialists, psychiatry, all on board to help with the mental well-being of our patients, because we know that there are traumatic things that happen that cause us burn injury. So dealing with that part of it, and really those are standards that are put forth by the ABA, stating that we have to have these in place because we know that's what the patient needs.
Yeah, that's very good. That's very good. Well, are there any other programs at UMC that you want to talk about of burn care center-wise? You've talked about collaborating with the community, the firefighters. Anything else that you need to add?
We do work with our Healthy Living Institute, so there are lots of different classes that they put on in collaboration with us. And all of those programs are generally free to the public, so checking out the website there. And then we do offer support groups for our survivors and families. That is on a monthly basis. Even if maybe they're new to the community but have a burn injury, feel free to reach out to us. We know that burn care is, we want it to be open to everybody that has suffered from these injuries.
Okay, so they just go, if you need any information or need help, just go to the UMC website and UMCSN, correct?
Yes.
And then there should be a link for the Burn Care Center.
That is correct, yes. There's a tab for the Lions Burn Care Center that has all the contact information there.
Or you can just call Jasmine.
Yes, absolutely.
Just kidding. But yes, this is a very good program. And we are going to show, again, the flyers on screen for our listeners and followers on the do's and don'ts of treating first aid treatments for burns, as well as how to seek medical attention. So thank you for providing us with those flyers. And for the listeners, just please avail yourselves with those if you're interested. So hopefully you are, because this is hot temperature, like I said. So, okay. So what is your message to the community about your final message about burns protecting themselves to the community in the summer heat?
I think the main message is about prevention. So we are here to treat any injuries that you may sustain, but our main goal is in trying to prevent some of these injuries from ever occurring. So we want to get the message out about some of the dangers that we face here in our community, especially this time of year with the heat, ways that people can protect themselves and avoid some of these injuries. But if something does happen, we are here to take care of you, and we're a 24/7 operation. We're always here for you. But if we can do our jobs right, it's about preventing these injuries. So really want to get the awareness out there.
Very good, very good. Yasmin, what's your message to the community?
I'd have to agree with prevention. That's the best treatment for burns. Really, with this triple-digit temperatures that we're facing, plan your activities ahead of time. If you don't need to be outdoors, try to avoid that. Go in the morning, go in the evening. And then also really staying hydrated. That's a big thing.
Yes.
Especially out in the desert. It is really dry out here. So preventing somebody from passing out because they're so hot will really help in the long run as well. And then if you do have to go out and you have limited mobility or have trouble moving around, asking a neighbor for help or just somebody to be there with you.
Yeah, those elderly and vulnerable populations are really important. So creating awareness is really good. So anyway, Mr. Ryan Moore and Ms. Yasmin Conaway, thank you so much for joining us today. We do appreciate the work that you do. So thank you for coming here. And we'll be collaborating again.
Excellent. Thank you very much for having us.
Yes, thank you for having us.
You're welcome. So to our listeners and followers, we leave you with this. Pavement burns are a type of contact burn when the skin comes into contact with a superheated surface such as asphalt and concrete. We see many of these types of burns every summer. There are also high-risk populations, such as the elderly, who suffer from multiple comorbidities. And beware of social media challenges that have grown in popularity, where children are sustaining life-changing burns because of these challenges. And we also thank the UMC Lions Burn Care Center that offers the highest level of burn care in Nevada. The Burn Care Center has served our community for over 50 years, and with dedicated professionals like Mr. Ryan Moore and Ms. Yasmin Ganaway and the whole UMC Burn Care team. So thank you for everything that you do. And thank you, Philippine NARS listeners and followers, for joining us today. Thank you for giving us the privilege of your time. This is Doris Bauer, your Philippine NARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine NARS, news and features about the Filipino-American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.